And thank you, Ms. Tavener, for being here and for your testimony. And I also would like to tell you how much I appreciate your personal involvement with compounding pharmacists in Mississippi and our discussions with you towards our shared goal of maintaining access to necessary pain medication for some of Medicare's most vulnerable beneficiaries. It was recently announced that the administration would be delaying the law's employer mandate until 2015. One of the reasons cited by the administration for delaying was to provide time to adapt health coverage and reporting systems while employers are moving toward making health coverage affordable and accessible for their employees, thereby decreasing the amount of uncompensated care that hospitals must provide. As you are aware, hospitals, which certainly are large employers and a crucial component of our medical landscape, are also faced with navigating a multitude of regulations. Delaying DSH cuts would grant these medical providers the same stability recently afforded other employers. If the mandate to provide new coverage is to be delayed, then so should any corresponding cuts to reimbursements for uncompensated care. In light of this decision, is the administration taking steps to delay the cuts to the DSH payments, to the disproportionate share hospital payments?
In the President's proposed budget for 2014, there is a request for delay of Medicaid DSH cuts for 1 year.
So you would agree that the administration has that authority to do that?
It's in the President's proposed budget for Medicaid, yes.
Thank you. Just last week, I received an email from a gentleman in Ridgeland, Mississippi, in my district. Forrest Collier is his name, and he noted that his family's health care premiums increased from roughly $8,000 last year to nearly $19,000 this year. That's an incredible jump. So we have a family in my home state that's seen their premiums jump from $8,000 to $19,000 a year. Not only does this limit Forrest's ability to provide for his family, but this rate shock also has kept the Colliers from doing the things that they enjoy most. In Mr. Collier's words, he said in his email, "Obamacare is a train wreck and is having a huge impact on working families." You know, he's right, and this is not what Mississippi families were promised.
So I actually think he's, obviously Obamacare from his perspective, rates have not gone into effect yet, but what he is experiencing is what's in my written testimony, is the last decade of double-digit, triple-digit increases. That is what the Affordable Care Act is designed to correct.
And if I may say this, he's not the first person. He wasn't the one who coined the term train wreck. Actually, there have been Democratic senators who voted for it who are declaring this a train wreck themselves. But the American people were promised time and again that working families would see a $2,500 drop in premiums. And in your testimony, and you claim, and I paraphrase, that there's a growing evidence that these reforms are working for the entire system, keeping costs low for consumers shopping for coverage in the private health insurance market. How can the administration make this claim when Mr. Collier's testimonial proves otherwise?